In this video, you will learn how to deal and present a short case of deep venous thrombosis. Deep venous thrombosis is not a common short case. As a result, students face difficulty in handling this case and they do not have idea how to proceed. Detailed video on short case of DVT is present on this YouTube channel where you can consult and learn how to deal with patient of DVT. Usually command is given examine the lower limbs of this patient and do the relevant examination. Remember, important differential diagnosis of DVT is cellulitis. Now you can observe the presentation of deep venous thrombosis short case. Sir, I have examined this middle-aged man. He is cooperative and lying comfortably. On inspection of lower limbs, left lower limb is swollen up to knee. Diameter of left calf is 3 cm more as compared to right. Swollen limb has redness and shiny texture. In addition, superficial veins are prominent. There is a pitting edema in left lower limb. Left leg is warm as compared to right leg. There is tenderness in area of swelling and patient feels pain on dorsiflexion of foot. Peripheral pulses are intact. On examination of right lower limb, there is no abnormality. Patient is afebrile, heart rate is 80 beats per minute, respiratory rate is 18 breaths per minute, and blood pressure is 130 by 80 mm of mercury. Heart sounds are normal and there is no parasternal heave. On chest auscultation, there is normal vesicular breathing with no added sounds. Jugular venous pressure is not elevated. There is no surgical scar mark. Moreover, there is no rash and evidence of rheumatological disease. My diagnosis is left lower limb deep venous thrombosis.